Hello, my name is Melinda Bagaga. I'm a student midwife and I've been a birth assistant with a local midwife for several years. I'm going to be talking a little bit about what it's like to be a birth assistant and how is it different from maybe the role of a doula, and how can you kind of step into this role of assisting at births a little bit more smoothly. So every midwife is going to do things a little bit differently. So it's really important to, no matter what you learn in this course, you're always going to want to go to your midwife that you're going to actually be working with and see what are your expectations of me as your assistant. Are you going to be asking me to do any clinical hands-on work with your patients? Will I be knowing how to, or will I be practicing blood pressure? Will I be doing fetal heart tones? Are you going to have me check on baby at all? IV starts. Do I need to know how to do IV starts? So there's a lot of things where one midwife will have you just chart and you never touch your patient. You're very much in the backdrops. You're there in case of an emergency. You're a fly on the wall. You don't really do much. And others are on the complete opposite end of the spectrum where they want you being fully hands-on through the entire process. So it's really important to talk to your midwife and kind of see where they envision you being a part of it. And then you can really hone your skills. If you're just going to be charting, get really good at charting. Know what do you want me to chart? What are maybe the acronyms or the shorthand that they typically use so that you can, kind of keep things cohesive with the way that they've done things in the past. And then you're going to want to know your midwife's birth bag. With your eyes closed. You want to know exactly where she keeps any of your postpartum hemorrhage, like it's an emergency, mom's bleeding, we need to deal with this now. I have 2 seconds to grab it out of your bag. I don't have time to shuffle around and look through things. I need to know exactly where that is. Baby's not doing well. We need to clamp that cord and cut it and rush that baby, with EMS or whatever it might be. For whatever reason, you need to know what's in that bag, exactly where it is, what it's used for, when you need to grab it. Those are some really, really important tools to have in your tool bag. So we've talked about knowing what your role is going to be. We've talked about knowing the birth bag, and that's not something that this course can actually teach you because every midwife, I like this type of bag and this is how I set it up. I bring 3 bags to every birth. Others shove everything all into one bag. They're all going to set it up differently, so we couldn't possibly go through that in this whole course. The last thing I'm going to talk about is quite often someone might come into a birth assistant role having had some previous birth experience. Whether it was my sister, it was my mom, maybe I gave birth, maybe I'm a doula, and so I've had some experience supporting moms through this whole process. So I'm familiar with the birth process. I kind of have an idea of what does it look like to be in early labor, in active labor, in transition. What does it look like to help a mom while she's pushing and having that early bonding time. As a birth assistant, we're going to have a distinct time where we shift from a doula role to a birth assistant role. So as a doula, we never do anything clinical. We're not going to diagnose. We're not going to do any heart tones, any blood pressure, or any charting. But as a birth assistant, you are very much in charge of those things. So it's really important that if you're with a mom and maybe she's getting up out of the birth pool and she's going to go to the bathroom, by all means, help her get there. Set her up, get her support team, and then you've got to go back and chart that. It's this time, she got up out of the pool, she's going to go to the toilet, labor there for a little while, she's probably going to void her bladder, and hopefully we're going to also be hydrating her at that same time because I'm real big on pushing hydration. So that is not something you do as a doula, but we always need to come back to that. I think the hardest time is right around the time of the birth. Quite often we can be very hands-on, doing hip squeezes, holding a hand, rubbing a back. But it's really important at that moment to, encourage Mom, come hold this hand, or Dad, do this hip squeeze, or, rub her back like this. Hopefully she has other support people present, because that way I can come back and I can be ready to chart. At this time we had a crown, at this time we had a full crown, at this time the head, maybe the body came out at the same time. I am keeping track of everything. Baby's out, skin to skin, the placenta, what time did it detach? Maybe we saw a small, separation bleed. What time did that happen? Because at the end, when the midwife is going through all of these notes and she's got to, put in her statistics or, time things out, she's going to go back and say, what time was that first latch? What time did we check for any tears? What time did I do that suture? What time did she get up and go to the bathroom the last postpartum? What time did we do that newborn exam? What time did we give the vitamin K? What is the lot number? All of that is probably going to be your job. So get really, really confident and used to every little thing. She just drank some juice, write it down. She just went to the bathroom, write it down. She just got up from the bed and now she's sitting on the birth ball, write it down. So every little thing, if in doubt, write it down. If she says something cute, and every midwife is going to have their own thing on this one, if she says something, that, maybe she'll want to remember this, because quite often the midwives at the 6-week postpartum, they'll give them a copy of their whole chart and they'll kind of enjoy looking back and like, oh, remember that time we were slow dancing while I was in labor and I said this thing, like, you can write it down. Some midwives don't want you to write that stuff down, but when in doubt, write it down. So hopefully you enjoyed getting a little bit of an inside scoop from a birth assistant who's been there, done that. And if you have any questions, feel free to reach out. Have a great day.